Diagnosis through the eyes. Physical changes. Physical changes in the eyes. In addition to diagnosis through observing the color of the eyes, the changes in the physical forms can also be used as criteria for diagnosis. If other abnormalities occur in the eyes, you should address them. Observing the form of the eyes aims to determine whether the overall physical form of the eyes is normal. If abnormality appears, example, abnormally tearing up, puffiness of the eyelids, or abnormalities in the pupils, it may suggest that there's a problem with your health. Abnormally watery eyes, as in the picture, this is a manifestation of insufficient liver blood. A deficient cold of liver meridian and deficiency of both liver and kidneys may all result in watery eyes. Abnormalities in the pupils. If one pupil is smaller than the other, or one pupil retracts at a slower rate or at a smaller scale, the person may be suffering from cerebral apoplexy. Exotropia. If both eyes are exotropic, it may indicate cancer or carbon monoxide poisoning. If only one eye is exotropia, it might signal diabetes. The puffiness of the eyelids. Abnormal metabolism of the kidney and gastrointestinal may lead to water retention in the body, leading to puffiness of the eyelids. Next, fat granules. Fat granules on the eyelids or around the eyes may indicate that your cholesterol level is too high. So tips for caring for your eyes. Maintain good eye hygiene. Avoid glaring light that irritates the eyes, and do not work at electronic devices such as your mobile phone or TV for a prolonged period. Consume a light diet and avoid foods with a pungent taste. Maintain a regular schedule of work and rest, and try not to stay up late. Massage the shingling point. The shingling point regulates qi, alleviates pain, soothes the chest, and calms the heart. Pat or press knead this point often, and it can relieve yellowing of the eyes. It also helps improve the symptoms of neuropathic headaches and angina. Massage the Shengqi point. The Shengqi point helps those who have uncontrollable watery eyes to improve this symptom. It can also treat eye disease such as short-sightedness, night blindness, glaucoma, and conjunctivitis. Eliminate fat granules. Keep the eye area clean to ensure the skin's normal function of excretion and absorption. Be careful to consume more light foods and a lower fat diet. Massage the skin surrounding the eyes every day to promote blood circulation and assist the metabolic function of the skin around the eyes. Thank you for your attention.
Let's discuss interviewing the pain part 3. Why we ask? We need to ask about pain because the character, location, and timing of pain give a clear indication of the full or empty character of the condition, and they also clearly indicates various pathogenic factors such as qi stagnation, blood stasis, dampness, etc. Obviously, another reason for asking about pain is that it is very common complaint and often the one that leads our patient to seek help. When we ask, obviously, we need to ask about pain in great detail when this is the chief complaint. However, even if the patient comes to us for a condition that does not involve pain, such as asthma, we should also ask whether the patient experiences pain in any part of the body. On the other hand, this may be uncover a condition that the patient did not report spontaneously, and on the other hand, an analysis of the character, location, and timing of pain may help confirm the original diagnosis. Indeed, in some cases, analysis of the pain may also add a new dimension to our original diagnosis. For example, a woman may present with the chief complaint of a mental depression, which we diagnose as being caused by liver qi stagnation. Before concluding the interrogation, we should ask whether she experiences any pain in any part of the body. If the patient tells us that she suffers from abdominal pain and distension, this would clearly confirm the diagnosis of liver chi stagnation. To carry the example further, if she also suffers from severe periods of pain with dark clotted menstrual blood, this clearly tells us that there is not only liver chi stagnation, but also liver blood stasis. Since the liver blood stasis is shown purely by menstrual pain, example, the tongue is not purple, we would not have known about it if we had not asked about pain. How we asked. When we ask about pain, we should ask systematically about the following four aspects: location, nature, timing, response to pressure, and temperature. Location of pain. The first obvious question is about the location of pain. It is important in this respect not to accept automatically the patient's description of the location of pain. Patients often have their own way of describing a certain location, a common one being stomach when they mean lower abdomen. When the pain is in the abdomen, it is particularly important to establish exactly where it is by asking the patient to point to its location. It is even more important in children whose terminology is obviously limited and who often refer tummy ache. In channel problems, it is also important to inquire exactly about the location of pain in order to identify the channel or channels involved. For example, if a patient complains of a shoulder pain, we should inquire clearly whether the pain is in the front, the lung channel, the center, the large intestine channel, or the back of the shoulder, small intestine channel. However, in channel problems, the identification of the exact location of the pain must be done also with the help of palpation. Thank you for your attention.
Let us go to pattern differentiation. The topic is TCM diagnosis, part 3. Essential questions for TCM pattern diagnosis. In the next slides, we will be looking at a table that lists groups of signs and symptoms frequently encountered in the clinical practice and its most common correspondence to TCM patterns. They should always be investigated and considered of relevant importance for diagnosis and treatment in TCM. So here we will look at a table with its main clinical manifestations and its principal related patterns. If there's lumbago, heat in palms and feet, or cold feet, knee pain, and impotence, that is a pattern of kidney deficiency. Where there's depression, irritability, indecision, stubbornness, bitter mouth, and costal pain, that may be liver stagnation or deficiency patterns. When there's palpitations, anxiety, and insomnia, that's heart patterns. Abdominal distension, poor appetite, fatigue, inflammation, and loose stools is spleen and stomach patterns. There's cough, phlegm, stuffy nose, sneezing, itchy nose, throat, ears or eyes, thoracic pain or oppression, skin disorders, that is a lung pattern. If there's headache, depending on the location, could be yang channels, wind, qi, and blood dynamic, wind-cold invasions to tai yang, or liver yang hyperactivity. There's epigastric pain, hollow sensation in the mouth of the stomach, nausea, vomiting, heartburn, appetite or meal food preferences, could be stomach or spleen, stomach qi counterflowing upward, or liver stomach disharmony. If there are sleep disorders, that's a pattern of the heart, liver, kidney, and spleen. If there's fatigue, depending on time of occurrence, it could be kidneys and spleen syndromes. For thirst, with or without desire for fluids, that's heat and dampness patterns. If there's dry skin, forgetfulness, hair loss, constipation, numbness of the limbs, tendency to hypotension, loss of eyesight, excessive dreaming, difficulty in sustaining activity or effort, shoulder pain, difficulty raising the arms, or back pain, that's blood deficiency. When there is sweat, that's a lung or heart pattern, qi deficiency or yin deficiency. For urination, painful urinary dribbling patterns, damp heat patterns, kidney yin or kidney yang patterns. For disturbances in menstruation like leukorrhea, that's blood patterns that could be cold, heat, deficiency, and stagnation, or dampness. Thank you so much for your attention.
Let's now proceed to differential diagnosis in Western and Chinese medicine, and let's discuss bleeding, specifically hemoptysis and blood stool. Let's start with the Western differentiation of bleeding in hemoptysis and blood in the stools. This condition can be caused by coughing of blood in hemoptysis, and this can be due to pulmonary infection. And this is further differentiated into three: bronchitis, bronchiectasis, and pneumonia. In bronchitis, there is hemoptysis with cough, yellow-green sputum, shortness of breath, wheezing, fatigue, fever, and chest discomfort. In bronchiectasis, there is hemoptysis with cough, pulse, smell, and sputum, shortness of breath, weight loss, fatigue, wheezing, pallor, and bad breath. In pneumonia, there is hemoptysis, cough with green yellow sputum, chills, fever, sharp or stabbing chest pain, which is worse for deep breathing and coughing. And there is rapid shallow breathing and shortness of breath. Other causes include lung cancer, tuberculosis, pulmonary embolism, cystic fibrosis, gingivitis, nosebleed, and tonsillectomy. Next, we go to blood in stools. And blood in stools could stem from the upper gastrointestinal tract or from the lower GI tract. If it stems from the upper GI tract, it could be due to duodenal ulcer, where there is blood in stools, heartburn, belching, chest pain, and vomiting blood. Can also be due to gastritis, where there is dark stools, abdominal pain, indigestion, loss of appetite, nausea, vomiting, or blood or coffee ground vomit. Other causes include esophageal varices, bowel ischemia, vascular malformation. If blood in the stool stems from the lower GI tract, it can be due to hemorrhoids, where there is fresh blood on toilet tissue, anal itching, anal ache or pain, pain during bowel movements, hard, tender anal lumps. Can be also due to anal fissures, where there is blood on stool, pain during bowel movements, visible skin crack when anus stretched slightly, and constipation. Other causes include diverticulitis, inflammatory bowel disease, intestinal infection, colon cancer, bowel ischemia, vascular malformation. Now let's proceed to Chinese differentiation. So in Chinese differentiation, we look into first the organ interrelationship. Organs involved here are the liver and the lungs. This is the Creutzfeldt cycle. And the stomach and large intestines, these are the Yang Ming organs. Next, we go to the pathology of bleeding. If it's Qi deficiency, it means deficient spleen, Qi failing to manage blood, or center Qi falling causes pale, watery bleeding from lower orifices and hemorrhoids. If it's due to heat, it could mean heat of the blood aspect moving recklessly, profuse, bright blood. If it is due to empty heat, there will be scanty bleeding, and if it's due to blood stasis, there will be bleeding dark, clotted with pain. Now we look into color of blood in stools. If the stools are black and tarry, it can be problem from the stomach or duodenum. If the stools are purple and dark, it could mean the problem comes from the large and small intestines. And if the stools are bright colored, it could mean a problem from the anus or the rectum. Next, we go into the principles of treatment. So here we harmonize the blood, and this includes stopping bleeding, moving blood stasis, cooling blood, clearing heat, and nourishing blood. And next, we treat the root cause. We cool heat for the empty patterns to supplement Qi in deficiency. We move blood in stasis. We warm the yang in yang deficiency. We treat Qi. In Qi deficiency, we supplement Qi, subdue rebellious Qi, or raise Qi in Qi sinking. Next, we go to etiology. External pathogenic factors like wind heat, external damp heat, and also dietary factors, which includes too much alcohol, hot, greasy, or dairy food, and also emotional stress, which includes excessive, prolonged anger, resentment, frustration, which produces stagnation of Qi and often leading to fire. And it could also be due to physical or mental overexertion, which depletes spleen and kidney Qi, or can be due to chronic illness, childbirth, which causes Qi deficiency. Next, we look into the Zhangfu organ patterns. If coughing blood is an excess condition, it indicates liver fire insulting the lung. If it's deficiency, it's lung yin deficiency with empty heat. In blood and stools, if it's excess, it could be damp heat in the large intestine and also blood stasis. And if it's a deficiency condition, it indicates stomach spleen Qi deficiency or center Qi falling. Thank you for your attention.
Continue discussing kidney relationships. Outward manifestation in the hair. This means that the state of kidney essence is reflected in the condition of hair. The growth and loss of hair and its luxuriance or withering depend not only on the state of kidney essence, but also on nourishment by blood. This has given rise to the saying, hair is the surplus of blood. The reason is that the kidney stores essence, kidney essence engenders marrow, and the blood that comes from marrow nourishes hair. In children, the kidney's essential Qi develops and hair grows longer and faster. In adults, the kidney's essential Qi flourishes and the hair is lustrous and jet black. In the elderly, the kidney's essential Qi declines and the hair turns gray and withered and falls out easily. These are all physiological changes. In pathology, premature graying, withering, or loss of hair may result from deficiency of essence and blood. Opening in the ears and two yin orifices. The ears are the organs for hearing. The acuity of hearing is closely related to the state of kidney essence. Only when kidney essence is abundant can hearing be acute. If kidney essence is insufficient, hearing may be diminished. There may even be deafness. The decline in hearing or deafness in the elderly is usually due to physiological decline of kidney essence. There are two yin orifices, the anterior and the posterior. The anterior yin orifice is the external genitalia, which serves both urination and reproduction. The discharge of urine is under the control of the bladder, but functionally it depends on the kidney's ability to transform. If kidney Qi is insufficient, there may be disturbance of micturition, such as polyuria, oliguria, or anuria, enuresis or urinary incontinence or dribbling of urine. Disorders of the reproductive system, such as impotence, premature ejaculation, or spermaturia, are also usually caused by deficiency of the kidney's essential Qi. The posterior yin orifice is the anus. Defecation is mainly under the control of the large intestine and the spleen, but it also depends upon the transforming, warming, and holding functions of the kidney. For example, deficiency of kidney yin can lead to constipation, and deficiency of kidney yang can lead to mucoid diarrhea. Insecurity of kidney Qi can lead to prolonged diarrhea and rectal prolapse. Thank you so much for your attention. Okay.
Diagnosis according to Zhangfu organ patterns. Heart-yang collapse. Heart-yang collapse is a more extreme and more serious condition than heart-yang shu. Yang is now too weak to move the blood and body fluids. Heart-yang collapse may be a consequence of kidney-yang deficiency or heart-yang deficiency. The etiology of heart-yang collapse will be the same as that described for heart-yang deficiency. Symptoms and signs: palpitations, shortness of breath, shallow breathing, profuse sweating, cold limbs, blue or purple lips, gray or white complexion, possible loss of consciousness, pale or bluish tongue. The tongue may be short, deep, weak, or hidden pulse. Key symptoms: blue or purple lips, palpitations, and hidden pulse. The treatment principle would be to rescue the heart-yang. Acupuncture points: this is a severe and acute condition in which Western medical intervention is required. If this is not available, you can choose from the following: Ren 4, Ren 6, Ren 8, Do 4, Do 14, Do 20, urinary bladder 15, stomach 36, and pericardium 6. The needling technique would be to tonify, no retention of the needles. Moxa should be used. Direct moxa or moxa on ginger slices on Ren 4, Ren 6, and Ren 8 is necessary. The explanation would be urinary bladder 15 tonifies heart-yang, pericardium 6 circulates qi in the upper jiao, Do 4 and Do 14 tonify yang, Do 20 raises yang, stomach 36, Ren 4, Ren 6, and Ren 8 rescue yang. Relevant advice: this is usually an acute pattern, therefore lifestyle and dietary advice is not so relevant. It is important that the patient does not sweat because this will further weaken heart-yang. Heart-yang collapse can be caused by the following patterns of imbalance: kidney-yang deficiency, heart-yang deficiency. Heart-yang collapse can result in the following patterns of imbalance: collapse of yang and heart-blood stagnation. In summary, heart-yang collapse, etiology: repressed emotions, chronic illness, blood loss, excessive sexual activity, retention of dampness, overwork, and old age. The underlying or accompanying pathology would be kidney-yang deficiency, heart-qi deficiency, heart-blood deficiency. Signs and symptoms: palpitations and shortness of breath, weak and shallow breathing, cold limbs, profuse sweating, cyanosis of lips, coma if severe. The pulse would be hidden, minute, knotted. The tongue would be bluish purple or very pale. Treatment principle is to rescue yang and stem sweating. The acupuncture treatment: Ren 6, which stops sweating, Ren 8, also stops sweating, stomach 36, strengthens heart-yang, bladder 23, strengthens kidney-yang by moxa, Do 14 supplements heart-yang by moxa, Ren 4 rescues yang-qi, stops sweating, Do 4 supplements kidney-yang by moxa, pericardium 6 strengthens heart-yang, Do 20 rescues yang, bladder 15 supplements heart-yang by moxa, needle with supplementation. Thank you for listening.
Yes, Doc. Let's discuss etiology in Chinese medicine, the fire. Fire is transformed from excessive yang qi. It can readily intermix with summer heat. However, though they are similar, there is difference. Summer heat is gradual, whereas fire is an extreme form of heat. Illnesses of fire can also be exogenous or endogenous. An illness of exogenous fire generally results from direct attack by warm or summer heat. An illness of exogenous fire generally results from disharmony of yin, yang, qi, and blood of the visceral organs with exuberant yang qi and deficient of yin qi. Furthermore, when the passion becomes extreme, they can also, under certain conditions, produce fire Hence the saying, the 5 Qi transforming into fire and the 5 passion transforming into fire. The nature and pathogenic characteristics of fire are as follows. So we have here from the hot weather, there's smoke from smoking, alcohol, excessive intake of spicy foods, biopathogenic causes results into fire evil. So this tends to flame upward, having the patient would have a high fever, aversion to heat, thirst with restlessness, sweating. It could also disturb the mind, resulting into agitation and insomnia, mental disarrangement, coma, convulsions, stiff neck. It could also consume qi and body fluids, resulting into sweating, thirst with desire for drinking, oliguria with dark urine, constipation. It could also result into induced erratic blood flow, causing sores and ulcer. Various kinds of bleeding, like hemoptysis, nosebleed. It could also affect the stool with blood, urine with blood, profuse menstruation, etc. So here the fire evil, transformation of passion into fire, or mental depression transforming into fire could result into endogenous fire, having the result of a heart fire, liver and gallbladder fire, stomach fire, and kidney fire. Fire is a young evil, and its nature is to burn and flame up. Because fire burns, when it causes illness, mostly there are high fever, aversion to heat, thirst, restlessness, sweating, and a surging and rapid pulse. Because it flames up, most clinical symptoms involve the upper body, such as sore throat and inflamed gums. Since the heart is classified under the fire element, the fire evil can readily, though indirectly, disturb the mind, producing such symptoms as agitation and insomnia, or irascibility and erratic behavior, or delirium and incoherent speech. Fire damages body fluids effectively. It easily forces fluids to the outside and exhausts yin fluids. Hence, when the fire evil causes illness, there often are such symptoms as thirst with desire for drink, dry throat and parched tongue, scant dark red urine, and constipation, in addition to fever. Fire readily induces wind and stirs up blood, known in CM as extreme heat generating wind. When the fire evil invades the human body, it often burns the liver meridian and consumes its yin fluids. This causes the sinews to lose their nourishment and moisture and induces the internal movement of liver wind. The typical symptoms are high fever, delirium with incoherent speech, convulsion with rolling up of the eyes, opisthotonus. The fire evil also stimulates blood to move rapidly, scorching the vessels and inducing frenetic blood movement. As a result, hemoptysis, epistaxis, hematochezia, hematuria, skin purpura, and excessive menses or metarrhagia may occur. Fire also easily causes sores and ulcers. When the fire evil reaches the blood level of the warm disease, it can force blood to stagnate in a region, causing necrosis then ulceration. Clinically inflamed swellings and ulcers are all attributable to yang and to fire. Thank you for your attention.
Let us talk about the emotions. The topic is pensiveness. Pensiveness is very similar to worry in its character and effect. It consists of brooding, constantly thinking about certain events or people, even though not worrying, nostalgic hankering after the past, and generally thinking intensely about life rather than living it. In extreme cases, pensiveness leads to obsessive thoughts. In a different sense, pensiveness also includes excessive mental work in the process of one's work or study. Here we can see the clinical picture of pensiveness, where the where there's pale complexion, poor appetite, epigastric discomfort, abdominal distension and pain, tiredness, and the pulse is tight without a wave in the middle position. Pensiveness affects the spleen, and like worry, it knots chi. Chapter 39 of the Simple Question says, pensiveness makes the heart chi accumulate, causing the mind to stagnate. The upright chi settles and does not move, and therefore chi stagnates. Pensiveness will therefore cause similar symptoms as outlined above for worry: poor appetite, a slight epigastric discomfort, some abdominal pain and distension, tiredness, and pale complexion. The right middle pulse position, which is the spleen, will feel slightly tight but weak. Here we can see the effect of pensiveness. When there's pensiveness, it knots the chi. And when the chi is knotted, it affects the spleen, which causes spleen chi deficiency and spleen chi stagnation. It can also affect the lungs, that causes lung chi deficiency and lung chi stagnation. And also the heart. When it affects the heart, there could be heart chi deficiency and heart chi stagnation. The only difference will be that the pulse of the right side will not only feel slightly tight, but will also have no wave. One can feel the normal pulse as a wave under the fingers moving from the rear towards the front position. The pulse without waves lacks this flowing movement from rear to front position, and it is instead felt as if each individual position were separate from the others. In the case of pensiveness, the pulse will lack a wave only on the right middle position. A pulse without wave in the front and middle positions indicates sadness. Here we can see a picture of what we might see or feel on the pulse with a wave on the left side and without a wave on the right. The positive mental energy corresponding to pensiveness is quiet contemplation and meditation. The same mental energy that makes us capable of meditation and contemplation will, if excessive and misguided, lead to pensiveness, brooding, or even obsessive thinking. As a summary for pensiveness consists of brooding, constantly thinking about certain events or people, even though not worrying, nostalgic hankering after the past, and generally thinking intensely about life rather than living it. In extreme cases, pensiveness leads to obsessive thoughts. Pensiveness also includes excessive mental work in the process of one's work or study. Pensiveness affects the spleen, and like worry, it knots the chi. Thank you so much for your attention.